In this video, we're going to talk about a sensitive issue that many older adults in the USA experience, a urine-like smell that can appear even when you bathe regularly and take good care of yourself. This is something people in their 70s and 80s often go through, but very few feel comfortable talking about it. It can be confusing, embarrassing, and sometimes even upsetting when you notice this scent on your clothes, your bedding, or your skin. But I want you to know right from the start, this problem is not about poor hygiene. It usually comes from small daily habits and normal changes that happen as we age. Today, we will explain the 7 most common reasons doctors say this odor develops, and more importantly, what simple steps can help reduce it or get rid of it completely. Everything we talk about will be in clear, gentle language so you can understand exactly what your body needs. There is no shame in this topic. Many seniors experience it, and most of the time, the solution is easier than you think. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Point 1. Not drinking enough water throughout the day. One of the biggest hidden reasons many older adults begin to carry a urine-like smell is simple dehydration. As we age, the sense of thirst becomes weaker. That means you may not feel thirsty even when your body truly needs water. Many seniors drink only a small amount each day, sometimes just tea, coffee, or a few sips here and there. But without enough water, your urine becomes darker, thicker, and much stronger in smell. This stronger odor doesn't just stay in the bathroom, it can linger on your clothes, your bedding, and even your skin. When your body is dehydrated, your kidneys can't flush out waste as efficiently as they used to. The waste products become more concentrated, and those concentrated chemicals are what create the sharp, unpleasant urine smell many older adults notice. Even if you bathe every day, the scent can return quickly if your urine stays strong. Many seniors don't realize this connection and end up feeling embarrassed or confused because they're clean, but still notice the odor. Dehydration also affects your energy, your mood, your bladder health, and even your skin. Some seniors experience dizziness, constipation, or headaches without realizing those signs are connected to low water intake. And because older adults often drink less to avoid frequent bathroom trips, the dehydration becomes even worse over time. The solution is gentle and simple. Drinking small amounts of water throughout the day, not all at once, helps keep your urine lighter in color and milder in smell. Keeping a glass of water within reach, sipping after meals, or adding a slice of lemon or cucumber can make it more enjoyable. You don't need to force large amounts. Even steady, small sips can make a big difference. Improving hydration is one of the easiest and most effective ways to reduce urine odor and support your overall health. Your body works better when it gets the water it needs. Point 2. Ignoring incontinence or small bladder leaks. Another very common reason many older adults develop a urine-like odor is small bladder leaks that go unnoticed or unaddressed. Incontinence is extremely common after age 70. It doesn't always show up as a full accident, sometimes it's just a few drops when you stand up, sneeze, laugh, or move too quickly. Because the leaks are small, many seniors ignore them or hope they'll stop on their own. But even tiny amounts of urine left on the skin, absorbed into underwear, or caught in clothing can create a strong, lingering smell. What makes this issue harder is that many older adults feel embarrassed to talk about it, even with their doctor. They may try to hide the problem, wash only the area they can reach, or change clothes without realizing the bedding or chair might also need cleaning. Others simply don't notice the leak because nerve signals weaken with age and the bladder muscles lose some strength. This isn't a failure. It's a natural part of aging, and millions of seniors deal with it every day. But when leaks are ignored, the odor becomes stronger because urine stays on the skin longer than it should. The warm, moist environment makes the smell more noticeable and can even lead to irritation or infection. Some seniors try to mask the smell with perfume or powders, but these only cover the problem for a short time and often make it worse. The solution starts with honesty, with yourself and with your healthcare provider. Today, there are many simple, discreet products that help tremendously, like absorbent briefs, pads, waterproof mattress covers, and skin-safe wipes. Cleaning the area as soon as possible after a leak and changing into fresh undergarments can immediately reduce odor. Talking to your doctor can also lead to treatments that improve bladder control, reduce leaks, or address underlying causes. This isn't about shame, it's about staying comfortable, healthy, and confident. Point 3. Wearing the same clothes or undergarments too long. Another often overlooked reason many older adults develop a urine-like odor is wearing the same clothes or undergarments for too long. This happens more commonly than people realize. As we age, routines change. Some seniors try to save water, energy, or effort by rewearing items multiple days in a row. Others simply don't notice when clothes start to hold on to smells because their sense of smell becomes weaker with age. But even a clean-looking shirt or pair of pants can trap tiny amounts of urine, sweat, or bacteria deep inside the fabric fibers. When this happens, the odor builds up slowly. You may not notice it at first, but others around you might. Undergarments, especially, can hold on to scent even after one small leak. And because the fabric stays close to the skin, it warms up throughout the day, making the smell more noticeable. This can affect not just your clothes, but also your bedding, chairs, and anything else you sit on regularly. Many older adults grew up during times when people washed clothes by hand or used laundry sparingly. That habit stays with them, even though the body changes with age. Older skin produces different oils, medications can alter natural body odor, and even mild sweating affects fabric more quickly than it used to. That means clothing now needs more frequent washing to stay fresh. The fix doesn't have to be difficult. Changing undergarments daily and washing clothes that touch sweat or urine after one use can make a big difference. Adding a little baking soda or white vinegar to the wash helps break down odor trapped in the fibers. If laundry feels tiring or physically challenging, asking a family member for help or setting a regular wash schedule can be useful. Keeping clothes fresh isn't just about appearance. It's about comfort, confidence, and feeling clean in your own skin as you age. Point 4. Not cleaning the skin thoroughly after accidents or leaks. Another reason many older adults notice a lingering urine-like odor is that the skin isn't cleaned thoroughly after even a small accident or leak. This is more common than people realize, and it does not mean someone is unclean or careless. As we age, simple tasks become harder. Reaching certain areas, bending, standing in the shower, or washing quickly because of tiredness can lead to parts of the skin not being fully cleaned. Even a tiny amount of urine left on the skin can dry there and create an odor that stays for hours or even days. Older skin is also thinner, more sensitive, and more easily irritated. When urine touches the skin, the waste products in it can cling to the surface or get into small folds of the skin, especially around the thighs, groin, and lower abdomen. A quick rinse is often not enough to remove these substances. Over time, the skin may develop redness, itching, or rashes, which can make cleaning even more uncomfortable. This cycle often leads to seniors avoiding thorough washing, which then increases the odor. Another challenge is fatigue. Many older adults feel too tired to shower again after a leak or delay changing clothes because they want to rest first. Others feel embarrassed to ask for help, even when it's needed. This delay gives urine more time to sit on the skin, making the smell stronger and harder to remove. The good news is that there are simple ways to manage this problem. Using mild soap and warm water, patting the skin dry instead of rubbing, and applying a gentle barrier cream can protect the skin and reduce odor. Keeping unscented cleansing wipes nearby allows quick cleanups without needing a full shower. These wipes remove urine residue and keep the skin fresh between baths. There is absolutely no shame in needing extra support or tools as you age. Taking care of your skin is an act of dignity, self-respect, and overall health, and it can significantly reduce any lingering urine odor. Point 5. Overusing scented sprays or perfumes to cover odors. Another mistake many older adults make, often without realizing it, is relying too heavily on scented sprays, perfumes, powders, or air fresheners to cover up a urine-like odor. This usually comes from a good place. You want to stay fresh, you want your home to smell nice, and you don't want anyone to notice anything unpleasant. But using strong fragrances to mask the smell often makes the problem worse, not better. Here's why: perfumes and sprays don't remove odor, they simply layer another scent on top of it. When a strong floral or citrus fragrance mixes with the natural smell of urine, it creates a heavier, more noticeable scent that can cling to your clothes, hair, and furniture. Many people around you might pick up on it even if you can't. And for seniors with a weaker sense of smell, it can be hard to tell when the fragrance has become overwhelming. Another problem is that many scented products contain chemicals that irritate older, sensitive skin. Perfumes can trigger itching, dryness, and redness, especially if applied directly to the body or sprayed near clothing that touches the skin. Some seniors even develop headaches or difficulty breathing around heavy fragrances, making daily life uncomfortable. What truly helps is addressing the source of the odor rather than covering it up. Washing clothes more often, cleaning any areas affected by leaks, airing out rooms, and using unscented hygiene products make a much bigger difference. Odor-neutralizing laundry boosters or sprays designed specifically for senior care can help remove smell at its source without causing skin irritation or mixing harsh scents. Fresh air is also a powerful, natural deodorizer. Opening a window for even 10 to 15 minutes can refresh a room far better than any perfume. And focusing on cleanliness instead of cover-ups restores comfort and confidence. Remember, staying fresh doesn't require strong scents, it requires simple, gentle habits that support your health and dignity. Point 6. Skipping regular medical checkups for urinary health. Another important reason many older adults develop a urine-like odor is skipping regular medical checkups, especially those related to urinary health. As we age, our kidneys, bladder, and urinary system change in quiet ways. Sometimes these changes come with symptoms like odor, frequency, or leakage, even before pain or discomfort shows up. Unfortunately, many seniors brush off these early signs, thinking it's just part of getting older or feeling too embarrassed to bring it up with a doctor. But a strong or unusual urine smell can be the very first sign of a treatable medical issue. For example, urinary tract infections are extremely common in older adults and often show up with odor before anything else. Diabetes, dehydration, prostate changes in men, and certain medications can all alter how your urine smells. These aren't problems to feel ashamed of, they're simply health situations your doctor is trained to help with. Many older adults delay medical visits because they worry about being a burden, don't want to trouble their families, or feel nervous about discussing private topics. But avoiding checkups can make a simple issue worse over time. A small infection can grow, bladder problems can become harder to manage, and energy levels can drop without a clear reason. The good news is that doctors handle these conversations every day with respect, privacy, and kindness. A simple urine test or blood test can often pinpoint the cause of the odor in just a few minutes. Treatments are usually straightforward: antibiotics for infections, medication adjustments, or recommendations to support bladder health. By staying open and proactive, you can avoid many uncomfortable symptoms and protect your comfort and dignity. You've taken care of others your whole life. Letting a doctor take care of you now is not weakness, it's wisdom. Regular checkups are one of the strongest tools you have to stay healthy, fresh, and confident as you age. Point 7. Avoiding open conversations about hygiene and changing needs. One of the most overlooked reasons many older adults struggle with a urine-like smell is avoiding open and honest conversations about hygiene, health, and changing needs. Many seniors grew up in a time when these topics were private, rarely discussed, and sometimes even considered embarrassing. Because of this, a lot of older adults try to handle everything quietly on their own, even when the situation becomes difficult, uncomfortable, or overwhelming. But avoiding these conversations can lead to preventable problems that grow worse over time. As we age, our bodies simply don't work the same way they once did. Mobility changes, eyesight declines, and arthritis or fatigue can make bathing, laundry, and quick cleanups more challenging. Yet many seniors hesitate to ask for help because they fear losing independence, don't want to trouble anyone, or feel ashamed about the issue. That silence keeps them isolated and dealing with situations they shouldn't have to face alone. The truth is, opening up can make life much easier. When you share what you're going through with a family member, a trusted friend, or a caregiver, you're allowing someone to support you, not control you. Small conversations lead to big improvements, like help with laundry, getting better wipes or creams, organizing a bathroom for easier use, or finding products that make daily hygiene safer and simpler. Talking openly also reduces the emotional weight. Once the topic is no longer hidden, many seniors feel relief, comfort, and even renewed confidence. They realize they're not alone at all, others their age face the very same challenges. Doctors, caregivers, and family members are usually more understanding than expected, ready to help without judgment. Asking for support is not a sign of weakness. It is a sign of wisdom, courage, and self-respect. Sharing your needs openly helps protect your comfort, dignity, and quality of life as you grow older. As we come to the end of this video, I want you to take a moment and reflect on everything we've talked about today. The issue of a urine-like smell can feel uncomfortable, embarrassing, and difficult to understand, especially when you're someone who bathes regularly and tries your best to stay clean. But now you know that this problem often has nothing to do with poor hygiene. It's usually caused by small habits, natural changes in the body, and health needs that shift as we get older. The 7 mistakes we discussed: dehydration, ignoring bladder leaks, rewearing clothes too long, not fully cleaning the skin, using heavy perfumes, skipping medical checkups, and avoiding honest conversations, are all common, and all fixable. None of them mean you're doing something wrong. They simply mean your body is changing, and it needs a little more understanding and care. What matters most is taking these steps with kindness toward yourself. Even one small change, drinking a bit more water, washing clothes more often, using wipes after leaks, or opening up to someone you trust, can make a real difference in how you feel day to day. These habits support your comfort, your health, and most importantly, your dignity. Growing older does not mean losing freshness, confidence, or control over your body. You deserve to feel clean, comfortable, and respected at every age. You deserve routines that make your life easier, not harder. And you deserve to know that you're not alone in facing these challenges. Before you go, I'd love to hear from you. Please share one thing you learned from this video in the comments below, or one change you want to try this week. Your thoughts help others feel supported, and they help us create content that truly matters to seniors like you. Thank you for being here, thank you for watching, and I look forward to seeing you in the next video.